Well, now we know that historically that was the trend. What about here, now currently in the world? So this is a slide showing hospitalizations because of diarrhea and rotavirus in children less than the age of 5 in the US between 1997 and 2000. And this is to give you an idea of what sort of things we look at. So of the total burden of diarrhea of children being admitted in the US, about 1% was infectious. And then what was it due to? So about 34 to 35%, so 1/3 were thought to be viral, interestingly. So just kind of thinking through the paradigm of giving antibiotics for diarrhea, in the US, that's really not so. And then about 18% of that virus total was rotavirus. And then bacteria per se, so E. coli and salmonella type organs, were very, very low in incidence. So then what's different about the US and other parts of the world? So this is a picture from Juarez, Peru. It's a common source of bathing, drinking, sanitation. And I have had similar experiences in parts of Pakistan, in Bangladesh, and India, where you have this mixing of your sewage and drinking water. The other point is, even if the water isn't this open source, the drinking water that comes in the tap is not clean. So you can't just directly drink it. You have to boil it from before. So then so now that we're talking about globally, so then what are the global causes of child death in the world? So I have a box on the left talking about diarrhea. And then just as the pie, you can see diarrhea is about 9%. And in terms of absolute numbers, that's about 500,000 deaths. And then when you look at global trends in cause-specific mortality, so death in children aged 1 to 3 years of age, the biggest decline so that green boxes decline from 2000 to 2013, the biggest decline was because of reduction in pneumonia, diarrhea, and measles. And so what led to that decline? And again, this is just to show you the cause-specific diarrhea mortality in 2013 and the fact that we predicted going even further. So the reason why mortality from diarrhea has dropped is primarily because of the advent of ORS. So children are not, if they manage to get ORS, oral rehydrating solution, along with other interventions, which I'll talk about, such as zinc, the thought is that that's what's contributed to the decrease in diarrhea mortality. So what were some of the studies that helped understand what diarrhea was because of and how to treat it? So this is a slide talking about the Global Enteric Multi-Center study called GEMS. This was a large study investigating diarrhea cause in over 20,000 children in 4 African and 3 Asian countries, and it's funded by the Gates Foundation. And so what they showed was that a single episode of moderate to severe diarrhea increases the risk of death in young children by 8.5-fold at approximately 2 months after the diarrhea episode, which was very interesting finding, right? So the question was, well, the slides that I showed you showing decreased in diarrhea deaths is part of that because we're measuring these numbers from inside the hospital and we're not looking at a 2-month follow-up from when the patients go home. And then kind of, again, looking at the when, so 65% of deaths occurred greater than a week after enrollment, and about half died at a medical facility, and the other half died at home. And then without the 60-day follow-up, many deaths would have been missed. So again, sort of highlighting the fact that, yes, there's a global burden of diarrhea. It's gotten less over the past 20 years, but really we need to be more vigilant in looking at deaths outside of the hospital setting. So then what else did we learn from GEMS was which bacteria were responsible for diarrhea. So 4 pathogens, rotavirus, so that same pathogen that we see in the US, surprisingly, was very common globally also. So that's the topmost red bar. So rotavirus, cryptosporidium, shigella, and enterotoxigenic E. coli. And then as far as growth goes, which is an interesting point, and I mentioned that with regards to my research work, but in regards to diarrhea, these specific pathogens, so cryptosporidium in infants, ETEC and shigella in toddlers were significantly associated with linear growth faltering, so that there's asymptomatic carriage of these bacteria, and then it just leads to malabsorption and poor growth. So just a take home from the GEMS data was that there are 4 pathogens to think of when you see someone with moderate to severe diarrhea: rotavirus, Cryptosporidium, Shigella, and enterotoxigenic E. coli. And then think of Crypto, ETEC, and Shigella with regards to growth. And then again, looking, well, all right, rotavirus was clearly important in the US. It's important globally, but is it important in Cameroon? So yeah, Cameroon is one of the countries where you have 100 to 1,000 deaths per 100,000 due to rotavirus. So then what does rotavirus look like? So if someone either presents in your clinic or emergency department, rotavirus is an extremely dehydrating diarrhea. There's profuse watery diarrhea, vomiting. You can have severe dehydration very quickly, fever, and then repeat infections are common. And if they're repeated at that time, they can be asymptomatic. This is a picture of an 18-month-old child with rotavirus diarrhea and dehydration in Karachi. And just by severe dehydration, if you look at that tenting, so if you pinch the skin on a child's belly, it'll tent because of loss of turgor because of fluid loss. So what do we need to know about rotavirus now that we know it's very important? So one, that is age specific. So it's most common in infants and children aged 4 months to 2 years. And the reason why it's also relevant is you might want to think about antibiotics. Yes, of course, if your testing leads in that direction. But the first thing you should think of in your setting is rotavirus, and especially in these age groups. It's seasonal, so in winter to spring months in the US and in Cameroon, depending on the seasonal variability, in cooler or dry season would be when you would expect it more. And there's a fecal oral route. So now this is the interesting part. There are multiple strains that are circulating, and the strains are more diverse in developing countries. So what about prevention for rotavirus? So that's a key area of interest. In the US, we have both these vaccines available. There are currently 2 available internationally. So there's RotaTech, which is the purple one that you see. It's given in 3 doses at ages 2, 4, and 6 months. And then Rotarix, that's a single strain, and the purple one is 5 different strains. So Rotarix is given at 2 doses at 2 months and 4 months. So what does the WHO recommend? It recommends that rotavirus be part of all national immunization programs. I don't know if it's part of the program in Cameroon. I can tell you that in Pakistan, it's actually not part of the national program for immunization as of now. It has been accepted by the government, but it may take about 6 months to a year more to get it in. And then the WHO recommends that the first dose of either vaccine be given as soon as possible after 6 weeks of age. And it also says we shouldn't actually have this age restriction. So for example, I don't know if you noted, all doses are in the first 1 to 2 years of life. So what about in your population, in which, say, someone living in a rural area has not received rotavirus vaccine, should you give it or not? The WHO says yes. The other thing that to be part of the rotavirus vaccine strategy to control diarrheal illnesses has been promotion of early and exclusive breastfeeding. We'll talk about that some more. Hand washing with soap, improved water sanitation, and treatment packages, including ORS, but low osmolarity or ORS, and zinc. And I'll talk about these in a second also. So just a summary of the section we covered. Diarrheal illnesses still kill children around the world. It's mostly in kids less than the age of 5, and it's about 500,000, which is a decent number. Rate of deaths have been declining, but this does not include deaths looking at once they've gone home, so at a 2-month follow-up period. And then diarrhea incidence decline has been not so dramatic. Kids still get about 3 episodes of diarrhea per year.